Well, good evening, everyone. My name is Stacy Wheatley. I'm a clinical health consultant with True Health Diagnostics, and welcome to tonight's webinar. Tonight, we're going to be going over cardiovascular cocktails, exploring heart health supplements. And we've got a good number of people on the webinar already. We had quite a few registered. So I'm going to go over some basic housekeeping stuff before we get started and kind of wait for other people to jump on. If you are new to True Health, we are an advanced or a lab company that does advanced cardiovascular testing to help patients recognize and prevent cardiovascular and some metabolic diseases. I'm a clinical health consultant, of which I'm one of the dietitians. There's several of us. Sometimes there's nurses, and sometimes there's exercise physiologists, and there's several of us that have advanced certifications in diabetes, certified diabetes educator. Some of us are certified in lipidology or the study of cholesterol. So it's not just any Joe or Jane off the street. We are credentialed, registered and licensed dietitians, professionals, things like that. All right, I want to look at the questions here and see if anybody can type in their question box and just let me double check that everybody can hear me. That would be great. Awesome, thank you. Oh, wonderful. All right. This session is being recorded, and so if you guys miss something, if the kids are loud in the background, you miss something, I can send you a recording. I can also send you a PDF of the slides if you'd want to request one. I'm probably just going to use the email address you registered with. If you prefer another one, type that in the questions box for me, and I will make sure to send it to that one instead. There should be a good many of us on tonight, so I'm going to keep an eye on the questions, and if they get out of hand or I can't field all of them, I'll do my best to answer it to the email address that you provided. Also, I wanted to share with you guys if you like tonight's webinar and you want to do more, we have them about every month. Oops. And I was going to share that with you too. So these are the live webinars for quarter 1. We did lifelong resolutions and nurturing your mind and body in January. Tackling tobacco, we do that every even month. So every 2 months, Anna presents the Tackling Tobacco webinar to help folks quit smoking. Tonight is cardiovascular cocktails. In honor of Valentine's Day, we're going to love our men and do a webinar on men's health at the end of this month, presented by Chris Eastburn. Busting up sugar myths is a good one for folks on with diabetes or insulin resistance issues with carbohydrates. That'll be March 8th. And March 24th, know your numbers. For those of you who are existing patients, maybe you haven't met with one of the health consultants yet in your physician's office or on the phone. If you need some explanation about what the labs mean, you can either work with us personally or you can attend this webinar, and Amber will walk you through line by line what those labs mean and what you can do about them to improve them. Shortly, I'm starting to put together the quarter 2 webinars to let you guys know what's on the roster for the next 3 months. When we're finished, I'm going to go over, if we have time, I'll show you the various sites we have for social media, Facebook, Pinterest, all that fun stuff, our blog where you guys can find different articles on various topics. All right, we got a good number of folks on, so I'm going to go ahead and get started. So this is your agenda for the evening. The supplement market is huge, and we only have an hour. So these are the 6 that we're going to focus on. Remember, it's cardiovascular cocktails. So I'm not going to be able to take you on a whole tour through the vitamin shop and whatnot. We're going to focus on these 6 as they relate to your cardiovascular health. Vitamin D, omega-3 fatty acids or fish oils, niacin, folic acid, coenzyme Q10 or CoQ10, and red yeast rice. So starting off with vitamin D. Vitamin D is one of the 4 fat-soluble vitamins. Fat-soluble vitamins are A, D, E, and K. And it has a lot of roles in our body. It promotes calcium absorption, which is why you'll often find calcium and vitamin D in the same supplement. It reduces inflammation, it promotes cell growth and immune function, and helps maintain normal blood levels of calcium and phosphorus, 2 very important minerals to bone health. So if it's all about bone health, why are we concerned about it as it relates to your cardiovascular health? Well, it's highly associated with heart disease, hypertension, insulin resistance, and diabetes, metabolic syndrome, and then the other bone disorders of rickets and osteoporosis. Honestly, I had no idea before I started working with True Health that most of us are vitamin D deficient. Honestly, 80 to 90% of the patients I work with are vitamin D deficient, and they didn't know it. Symptoms include muscle aches, lower back pain, muscle weakness, and who doesn't have that? So it's a very common deficiency, and part of it may be due to vitamin D deficiency. Common symptoms might be due to vitamin D deficiency. And there's 2 forms of vitamin D. Vitamin D3 is synthesized in the skin when exposed to UV light. And vitamin D2 is synthesized by plants. And overdose or toxicity is rare, but because it's fat soluble and we tend to have enough fat on us, it can happen. You can take too much supplemental vitamin D, which is why we, of course, encourage you to discuss it with your doctor. Symptoms include kidney stones or decreased kidney function, bone loss, nausea and vomiting, loss of appetite. And sources of vitamin D include direct sunlight, 10 to 30 minutes, 2 to 3 days per week of unprotected sun exposure. You know, that's blasphemy nowadays with our skin condition. That, you know, we don't want skin cancer, so we always use lotions with SPF and wear sleeves and wear hats. But it's often enough to keep us from getting enough vitamin D. Foods, mushrooms, salmon, tuna, wild-caught catfish, mackerel, sardines, all those fatty fish your doctor's telling you to eat anyway. And then milk. Milk is oftentimes fortified with vitamin D. Supplements, vitamin D3 is often found in any CVS, Rite Aid, Walgreens, Costco, Sam's, and it's sold in international units or IUs. They usually come in 1,000, 2,000, 5,000. The 10,000 units are typically prescriptions and taken once a week. Personally, I take 2,000 a day as good insurance that I'm adequate. I think I have a pretty healthy diet, but when I ran my labs, I was just barely adequate. D2 is also in the pharmacy section, but the majority are sold as prescriptions. I shared with you some of the common dosages, but again, your physicians should decide initial loading or maintenance therapy levels. We can make recommendations, but it's ultimately best to do what your doctor says. So this is what it looks like in our lab report. You can see over here the optimal range is between 30 and 100, so that's quite a range. We wouldn't really tell anybody to stop supplementing or slow down until it reaches about 70 to 80, which is, I've never seen it. Most folks, when they're adequate, are only around 30, 40, 50, and this example is right at 40. If you're not familiar with our lab report, when the labs come back, if they're optimal, we color them green. If they're intermediate, we color them yellow. And if they're high risk, we color them red, kind of like a stoplight. So the goal is to be above 30. Most patients I find are maybe in the teens or low 20s. All right, that is vitamin D. Oh, no.
Hear me? Looks like we may have lost, you may have lost me a couple minutes ago. Is that accurate? All right, thanks, Judith. I will back up some. Can you tell me where the audio went out? I apologize, y'all. I got off, I was on my, oh, next. I got a buddy, she's keeping me on point. I appreciate that. I was on my I was on my telephone, my earpiece, and apparently it went out, so I apologize. Being that it's after hours, I am at home, so if you hear anything in the background, dogs, I apologize now. So vitamin D deficiency is associated with all these things: heart disease, hypertension, insulin resistance, so that's why we check it. The thought is that if we can catch the deficiency early and correct it, that it might help reduce your risk of cardiovascular disease. There's the dog. I apologize. Okay, and then the symptoms of vitamin D deficiency include muscle aches, lower back pain, and muscle weakness. And who doesn't have that? So it might often go unnoticed or kind of brushed aside as something else. So there's two forms, D3 and D2. D3 is the one that's synthesized in the skin, but because we are encouraged to not get skin cancer, use SPF. Our lotions have sunscreen in them. We wear sleeves. We wear hats. We don't want to get skin cancer, so we cover up, and then oftentimes we don't get enough vitamin D synthesized in our skin. Vitamin D2 synthesized by plants. And overdose or toxicity is rare, but because it is a fat-soluble vitamin and we tend to have plenty of that, it can happen. Oftentimes when you're just supplementing too aggressively. Symptoms include kidney stones, decreased bone or decreased kidney function, bone loss, nausea, vomiting, and lack of appetite. Sources of vitamin D, direct sunlight, again the UVB rays, 10 to 30 minutes on 2 or 3 days per week. More exposure does not necessarily guarantee you more, higher vitamin D levels. Those fatty fish your doctor's telling you to eat anyway. Salmon, tuna, mackerel, sardines, also wild-caught catfish, mushrooms, and fortified milk. Supplements are D3 and D2. D3 is easily found in most pharmacy sections sold in IUs. You'll see them in 1,000, 2,000, 5,000 units. Your doctor can prescribe a 10,000 unit dosage. I personally take a 2,000 unit dose just for insurance because I was barely adequate when I was tested. So D2 is also sold in the pharmacy section, but mostly as prescription. And I shared with you dosing, but ultimately the initial loading and maintenance therapy levels are determined by your doctor. So again, apologize if we've already gone through this, but hopefully you can hear me now. Our lab test is organized kind of like a stoplight. Green is adequate or optimal, yellow is intermediate in the middle, and red is a high risk level. So high risk for cardiovascular disease. Optimal levels of vitamin D3 are between 30 and 100, so that's quite a buffer or quite a room. And we wouldn't recommend you slow down or back off of your supplementing until you're about 70 or 80. Most patients I find are in the teens, 20s in this intermediate risk range. All right, on to omega-3s. Omega-3s are polyunsaturated fatty acids, meaning they have more than one unsaturated fatty acid bond, if you want to get all chemistry-like on it. Omega-3 fatty acids have been shown to maintain cardiovascular health, reduce incidence of cardiovascular events, reduce your triglycerides, which is what I most often see them recommended for patients, increasing HDL, and improving your LDL particle size. And that's something we test with True Health as part of your lipid panel, not just how much LDL you have, but what size and shape those particles are in. Because the smaller they are, the more dangerous they are, and the more likely they are to get stuck. Currently, other studies are looking at additional benefits for arthritis and dementia, which is pretty neat. So the three most important omega-3 fatty acids for us are EPA, DHA, and ALA. EPA and DHA are essential fatty acids, which means you can't make them yourself. So we have to eat them. We have to get them from elsewhere. ALA doesn't necessarily have the same benefits of EPA and DHA. ALA is most often found in vegetarian or plant sources. Your body has to break down ALA into EPA and DHA, and there's a wide range of variability in that, how efficient we are at breaking that down. So it's harder to standardize a dose of ALA or flaxseed oil because you really don't know how much each person is going to metabolize it. Sources of omega-3s include salmon, mackerel, sardines, all the ones we said earlier that were good for your heart health. Albacore tuna and herring. There is a difference between the fatty acid content in albacore tuna and the chunk light or the pink tuna, about 500 milligrams difference of the EPA and DHA. So the white stuff is a little bit better. And you'll hear a lot about mercury being in these things. If you're, if you're considering getting pregnant or you are pregnant, you might want to limit that stuff. But if you're not, in servings of 3 ounces once or twice a week, it's probably not going to hurt you. Food sources of ALA, flaxseed oil, canola oil, olive oil, chia, and walnuts. Now, omega-3 fatty acid supplements. As with all supplements, this is a multi-billion-dollar industry. So everybody's in it to make a little money. And believe it or not, they don't all have the best intentions. And they vary greatly in the omega-3 content in the actual pills. So in order to keep them shelf stable, they're going to have glycerin and fillers and antioxidants, vitamin E to help keep it fresh, things to help keep it clear and from going rancid. So a fish oil is not a fish oil is not a fish oil. They all range in quality and concentration. So most regular fish oils, let's say this is a 1,000 milligram pill, really only 30% of it, or 300 milligrams, is omega-3. There's other fish fats and things in there. Then you might have to find a double concentrated one, 600 milligrams, and then a triple strength, or something like Lavazza or Vasipa. Those are the highly regulated prescription strength fish oils that your doctor will have to help you get. And oftentimes they might have to prove that you have high triglycerides to do that. So over the counter, you want to purchase products that are higher in EPA and DHA specifically, not just, quote, fish oil or omega-3s. The difference between a single versus a double versus a triple strength is the amount of the EPA and DHA. So you'll see pills that range from 1,000 to 1,400 milligrams, but it's not 1,000 to 1,400 milligrams of EPA and DHA. It's a general the general term is just fish oil. So you need to read the labels, just like you do with the nutrition facts. You want to turn that over and look at supplement facts and see the line items EPA and DHA. So that'll determine, the concentration will determine how much you have to take to get there. How much should you take? Aim for about 750 to 1,000 milligrams of EPA and DHA combined. So I'll share this with patients and they'll say, but I take 1,000 milligrams of fish oil. You're not taking 1,000 milligrams of EPA and DHA. Patients with a high history of triglycerides or cardiac events, a lot of inflammation, they may want to aim for the higher side of the recommendations, and definitely, as always, discuss with your doctor. So, we're all over the country with these national webinars, but I did want to point out some pretty common ones. Kirkland Signature Natural Fish Oil from Costco is a pretty popular one. My husband takes that one. Members Mark Double Strength Omega-3 Fish Oil. Patients have had good success with that. If you ask me, I prefer Nordic Natural Omega-3 Fish Oil. You can get those at Vitamin Shop online, drugstore.com, Amazon.com. You just want to be careful with some of these that the product's not expiring and they're not just trying to get rid of old fish oil. So while we were on, I wanted to, let's see. Oops, sorry. If I send you a copy of the slides, these green links should link to the fish oils. So you can find supplement facts online. And hang on one second. All right, sorry, y'all. Prescription strength ones, the ones I mentioned, Lavazza, Vasipa. Vasipa is EPA only. And then what about krill oil? Because everybody always asks about krill oil. One 500 milligram capsule of Mega Red has only 54 milligrams of EPA and DHA. That's not a lot. And in order to get 750 or more, somebody's going to have to consume up to 14 capsules a day. That's a lot, even if they are small. They're recommending 1 capsule a day, and that's just kind of a drop in the bucket. So at 14 capsules a day, I don't think that's very cost effective either. So you'll want to check out the labels and maybe consider another product. I do believe they make one that's more concentrated, so you may not have to take quite as many. Okay, so side effects. A lot of patients will complain about an unpleasant taste or belching, fish burps. Some folks have looser stools or diarrhea, some glucose fluctuations in type 2 diabetics. Some tips to help with that are to take them at night. If you take them before you go to bed, you're probably not going to be burping in your sleep. At least I don't think so. You'd have to ask my husband. Take them with a meal. That kind of helps bury them and settle them a little bit more. And put the capsules in the refrigerator or the freezer. Personally, I'm going to forget them there, so you might want to put you a note on the bathroom mirror or something like that to remind you. Purchase a flavored fish oil, flavored liquid fish oil. Those Nordic Naturals I mentioned are lemon flavored. I don't know that personally by having bitten into them, but I've never had an issue when I burp them, or when I burp after taking them, or anything like that. Now, you know, they are more expensive. They're a little bit higher quality, but I decided I'd be a little bit lower maintenance and start trying my husband's Costco version. And then, you know, an hour after I took his, I started burping. So I went straight back to the pricier ones and have never had a problem since. And then purchase enteric coated capsules, ones that break down a little lower in the GI, so you don't burp them as much. And our lab report, we do a patented omega-3 index. That's pretty cool. I mean, you want to, if you're taking fish oils, you want to keep an eye on the LDL particles and the triglycerides, but we can also use this omega-3 index to see how well you're doing taking these fish oils. If you want to get greater than 8% to help reduce your cardiovascular risk. So most of the other labs you want lower. This one you actually want a little higher. And you'll see there it says percent of EPA and DHA in RBC. That's your red blood cells. So I compare this to maybe the hemoglobin A1C diabetic checks to see how they're doing with their blood sugar. This is kind of like looking at your red blood cells for how much heart healthy fatty acid you're taking. Most folks are deficient in this or pretty low. Yeah, I only see them get over 8 in folks that are very diligently taking their fish oils and taking enough fish oil over a consistent period of time. And niacin. Niacin is vitamin B3 or nicotinic acid. It's water soluble, so if you get too much, your body will just urinate it out. It performs lots of roles in the body. It can increase your good cholesterol, your healthy helper HDL cholesterol. It can decrease your risk of cardiovascular events. It can help reduce LDL cholesterol, reduce triglycerides, repair DNA, produce steroid hormones, and decrease this LPA. If you're only familiar with traditional lipid panels, you're probably not familiar with LPA. LPA is kind of LDL's bastard cousin. LPA is atherogenic, it's genetic, it's sticky, it's stubborn, and it does not want to come down. Most conventional methods won't help reduce LPA, but niacin can decrease the particle number of LPA in some cases. All right, so there's tons and tons of niacin supplements. Immediate release or crystalline niacin is the best one. Slow release or sustained release is available too, and then the flush-free or no flush supplements are available, and they tend not to be as effective for what you're trying to achieve. Prescription strength niaspan is what your doctor may prescribe you. And side effects include flushing, headache, itching, or upset stomach. We put my husband on that. I talk about him a lot, I'm sorry, because he has issues with some of his cholesterol, and he could not stand it. He hated it. We tried everything, like avoid, well, we didn't do that. We took the aspirin, the 81 milligram baby aspirin with it 30 minutes beforehand, and took it with a cool beverage, took it after eating, and he still had issues tolerating it. You might want to take it at bedtime. Hopefully the flushing would not occur until afterwards, after you're already asleep. Take niacin with a low-fat snack, Triscuits, wheat thins, maybe some low-fat cottage cheese, applesauce, things like that. And soluble fiber may help too. So niacin, don't start it or stop it unless your doctor has told you to do so. Don't crush or break it, especially if it's a slow release. It's that coating that is supposed to be helping you release it more slowly. Don't use it if you've had liver disease, active peptic ulcer disease, bleeding conditions. That flushing will make the bleeding worse, or hypersensitivity to niacin or niacin-containing products. Now, a lot has come out in the last couple of years. There's been 2 trials I wanted to tell you about. As a result of these, some of my physicians have kind of given up on niacin. Some doctors are still huge fans of it. It's just kind of based on the doctor. This AIM High trial, though, showed no benefit of the addition of niacin to folks who were already on statins. They looked at a group of statin patients and statin plus niacin patients, not just niacin patients. So this is only specific to patients already on a statin. Now, only 80% of the subjects enrolled made it into the trial due to the side effects. They all dropped out because of the flushing. The remaining 20% were mostly white males with metabolic disorders, and that trial was stopped early due to futility. In those patients that remained, some markers of cardiovascular risk improved, but the overall number of cardiovascular events did not change. All right, and then that's a typo, HPA-THRIVE trial. A third of the subjects dropped out. A third of the subjects left had metabolic syndrome and insulin resistance. And a third of those who were diabetic saw a 55% increase in issues with their blood sugar control. So that's not great. Those who weren't diabetic showed a 32% increase in diagnosis later in life. The bottom line, kind of weigh the pros and cons with your doctor. We keep saying that, but they're the best ones. They know you better than I do, and have known you longer, and they have more prescriptive experience to base their decisions on. Now, folate and folic acid. This one's really fascinating to me. We, with True Health, can check for MTHFR mutations. It's kind of interesting listed here. There's 2 different mutations we check for, and these are genes that affect how your body metabolizes folate. And the other lab involved here is homocysteine, and I'll discuss more about these here in a minute. Folate is a B vitamin found in foods like green leafy vegetables. So spinach and dark green salad vegetables and kale and all those good things. Folic acid, though, is a man-made vitamin. It can be found in supplements. It's fortified to many cereals and grains. And the thing is that because of these MTHFR mutations, some people are not able to break down and use folic acid or folate as well as others. We need folic acid and folate. They help synthesize and repair DNA. They help us produce healthy red blood cells, prevent anemia, and they normalize this homocysteine stuff. Homocysteine is an amino acid that's used to make proteins. It can be elevated due to low levels of active folate, B12, or B6. Elevated homocysteine levels can increase your risk for coronary heart disease, peripheral vascular disease, deep vein thrombosis or DVTs, pulmonary embolism or the clot in your lungs, or stroke. So homocysteine's no joke. It can kind of tear up the blood vessels and promote this, inflammatory response, and then increase the chance or the odds that you think you're going to have a stroke or a blood clot. Pretty scary stuff. So this MTHFR gene, that's methyl tetrahydrofolate reductase. It provides instructions for making the enzyme that converts inactive folate to an active form that your body can use. So if you have mutations on these genes, no matter how much folate you eat, you're not going to be using all of it. You end up with a deficiency unbeknownst to you. So that active form of folate is needed to normalize homocysteine by converting it into another amino acid called methionine. Y'all didn't know you were going to chemistry class today, I bet. A special type of folate called L5-methylfolate may be needed for those of us with this mutation to help reduce homocysteine levels. Oftentimes it's combined with other B vitamins like B12 and B6. Folate and B12 both have to be methylated to be useful in this pathway. So a lot of times they're packaged together. Foods naturally high in folate. Spinach, like we said, asparagus, turnip greens, collard greens, broccoli, legumes or beans. Sometimes I call this the beans and greens vitamin. Egg yolks, sunflower seeds, bananas, and strawberries. So also to help lower homocysteine, if you're going to use a supplement, if you have, or if you know you have the MTHFR mutation, you want to look for this L-methylfolate supplement. Over the counter, they come in 400 to 800 micrograms. And prescription, they're called Metnex, Deplin, Nevo DHA, and Serfolin. Metnex and Deplin, I think they're branded for different purposes, like diabetic neuropathy, or I believe depression too. And that's because this L-methylfolate is implicated in neurotransmitters. So we check MTHFR and homocysteine to help assess your cardiovascular risk. But for some folks where standard prescription therapy hasn't been helpful for depression, it may actually be related to this sneaky MTHFR genetic. If you do not have an MTHFR mutation, increase your intake of foods fortified with folic acid, with cereals and whole grains, but I should caution you there if carbohydrates are an issue. So don't go eating more breakfast cereal just because you need more folate. Folic acid containing supplements are okay if you don't need the special form of folate if you don't have that mutation. Otherwise, it's kind of a waste. And as always, ask your provider before you start that stuff. Really, I don't think it's harmful, but it might be a waste of time for you if you don't have that MTHFR gene, a waste of time or money. So discuss it with them, and we can check that for you if the doctor uses us. All right, so Coenzyme Q10, CoQ10. An oil-soluble, vitamin-like substance found in highest concentrations in the heart, liver, and kidneys. It's produced by the body and obtained through the diet and supplements, and it acts as an antioxidant. It's also been shown to inhibit the oxidation of LDL. When LDL starts to cause you a problem, it gets in the walls of your arteries. It's become oxidized. So if we have this CoQ10 acting as an antioxidant, it can help fight against that and potentially help lower your risk of cardiovascular disease. Sometimes it's recommended for patients taking a statin because statins may lower levels of CoQ10, so it's trying to help return you to normal, basically. And CoQ10, serum CoQ10, is another lab that we can check for you. Best for, I believe the parameters that we have in the lab are intended for patients already on statins to see if you're adequate. Suboptimal levels may also be related to oxidative stress from smoking, obesity, or a diet high in processed foods, sugars, and trans fat. So should you take CoQ10, always discuss it with your doctor. It can be expensive to take. You can get them at the big box stores like Costco and Walmart. But which form is better? You want to look for a ubiquinol form over a ubiquinone form because it's better absorbed. How much? There's a great variability and there's a lack of standardization in the market. So that's something to discuss with your doctor. You might just start with the standard dose on the bottle, and if the muscle soreness doesn't relieve with that, you might increase from there, but that's again up to your doctor. Mixed results from studies. They may increase blood levels, but not be enough to really help you with the muscle soreness and get into the muscle. But otherwise, it's very safe and not likely to have a very toxic effect. All right, so red yeast rice. A lot of folks that might be opposed to statins are attracted to red yeast rice because it's more natural. It's made by growing a particular strain of yeast on rice. Contains 4 active compounds called monocolins that help inhibit your liver's synthesis of cholesterol. So it helps decrease how much cholesterol your liver is making, kind of like a statin would. It's considered a food or dietary supplement. But it could be classified as a drug by the FDA when it's standardized to contain a specific amount of monocolin K, or what a prescription statin would have. They're not standardized among products and are generally not published on labels, so a lot of times you don't really know what you're getting, and they may even contain a mycotoxin called citrinin, and that's probably not going to be good for you. So because they're similar to statins, a lot of the claims will claim to improve lipids and reduce cardiovascular events. A lot of these products aren't sold in the US or approved by the FDA, and I'll share with you on the next slide a couple of products that are actually have warnings from the FDA. Don't start taking it though without your physician's consent, and side effects might include muscle problems and kidney impairment, so you don't want that. So there's 3 brands with FDA warnings. The red yeast rice sold by Swanson Healthcare Products and manufactured by Nature's Value. Red yeast rice or polycosonal complex sold by Swanson Healthcare and manufactured by Cabco Inc. in Cholesterix, sold by Sunburst Bioorganics. So check your products and make sure you're not taking one of those. References. Here's a couple of references from us that we used in tonight's presentation. Thank you all, and I want to go ahead and put this slide up with my email, our website, and various social media avenues for you guys to check us out with. Now I'm going to take a peek at questions while we're taking a look at this. So y'all fire away. See one hand up. I'm going to see if, oh, where'd you go? Okay. If you have a question, yes, you may get a copy of our slides if you just type in, or I have your emails that you use to register, and if you type in the questions box that you want a copy of the slides, I'll make sure to send it to you. If you want me to send it to an email address that is not the one you registered with, put that in the questions box. There we go. All right. So, like I said, if you guys are on Twitter, the lab company has its own handle at True Health Diag, and then I'm personally on there with a few other health consultants at THD_Stacy W, and we share a lot of our blogs that way. Facebook, everybody's on Facebook nowadays. Check out our Facebook page. Our blogs are on that. Also, announcements about our future webinars will be posted there as well. Our blog, that's where, you know, we all write our articles on different various subjects, blog.truehealthdiag.com. I'm currently writing a lot of them and kind of helping the other health consultants get their materials on there. So lots of good stuff there. And then Pinterest, pinterest.com/mytruehealth. Lots of good contact on those. Now, I'll see lots of requests for the slides. I'm probably just going to blind copy everybody for that one. Also, the question about cholestyramine, I will email you directly there. All right, folks, we're a little early tonight. I hope you join us for a future one. I hope you learned a lot. And if you have any other questions after we get off, you think of them, feel free to shoot me an email. And take care, stay healthy, and we hope to see you in the future.